Welcome to Indian Anatomist. Individuals who wants to perceive career in medicine are welcome to check out the YouTube channel Indian Anatomist. Today's lesson is part of ongoing lecture series, and the subject is General Anatomy 4. The topic is General Anatomy of Skeletal System. In my most recent video on General Anatomy 4, I covered the classification of the skeletal system and the numerous bone shapes. One category includes long bone. Dear students, in that video, I explained about the epiphysis, metaphysis, diaphysis, and epiphyseal plate of long bones. The video will not conclude until the blood circulation of long bones is discussed. Now, I will explain to you how long bones get their blood supply. Stay watching. What is purpose of blood supply to long bone? 1. Bone remodeling. 2. Bone repair, and 3. Bone homeostasis. This is applicable to all the body tissues. How do long bones get their blood? Blood supply of the long bone accounts for 5 to 10% of the cardiac output. A typical long bone receives blood supply from various sources. They are the nutrient, epiphyseal, metaphyseal, and periosteal arteries. The nutrient artery supplies directly from major systemic arteries, present adjacent to it. Nutrient artery is a high-pressure system that comes from the systemic artery, closer to the shaft. It enters into the marrow canal of the long bone, through the nutrient foramen. In the canal, it splits into two, that go up and down, and get closer to metaphyses. As these branches move up and down, they give off small parallel arteries called radial branches. These radial branches bring blood to the bone marrow, and inner two-thirds of the diaphysis. Both the ascending and descending branches meet at the metaphysis. From there, they split into smaller spiral branches that connect to the metaphyseal and epiphyseal arteries. Periosteal arteries are low-pressure system that abundantly situated deep to the attachments of the skeletal muscles and ligaments. They branch out beneath the periosteum, which is the covering of the bone, and are connected to the Haversian and Volkmann canals of the Haversian system, a microscopic system. The periosteal branches are responsible for supplying the outer one-third of the shaft of long bones. In adults, particularly in short long bones, the periosteal vessels are responsible for providing the blood to majority of the bone, rather than the nutrient vessels. Now, what are metaphyseal arteries? Metaphyseal arteries arise from nearby systemic vessels, and directly enter the metaphysis. It supports the nutrient arteries, ascending and descending branches. These anastomosis, or arterial union, with the spiral arteries, making the most vascular area of the long bone. Metaphyseal plate, and epiphyseal fusion, creates the vascular anastomosis. This is very important in adult long bones, because this vascular anastomosis prevents the osteomyelitis. The epiphyseal growth plate nourishment originates from metaphyseal and epiphyseal perichondrial arteries. Now coming to the epiphyseal artery. The non-articular region of the epiphysis in long bone is the source of the epiphyseal arteries, which themselves originate from periarticular vascular arcades or circulus vasculosus. These non-articular surfaces have many vascular foramina, although only a small number admit arteries, that is, epiphyseal and metaphyseal. The rest serve as venous outlets. It is possible that the relative vascularity of the two ends of a long bone can be inferred from the number and size of these foramina. This is a schematic picture showing the pathway of periosteal artery. It enters into the compact part of long bone through horizontal perforating Volkmann's canal and vertical Haversian canal. Through this, the blood perfusion occurs in outer one-third of the shaft. This is a schematic picture showing the pathway of periosteal artery. It enters into the compact part of long bone through horizontal perforating Folkman's canal and vertical Haversian canal. Through this, the blood perfusion occurs in outer one-third of the shaft. This is the area, indicating the anastomosis of all the arteries, that is epiphyseal, metaphyseal, periosteal, and nutrient arteries. This type seen in adult long bones after the completion of ossification. Because of this anastomosis, the bone ends, establishes the collateral circulation, that is the power of anastomosis. At the same time, in children's, before ossification completes, the blood vessels are separately supplying the independent area of long bone, and no anastomosis occurs. Because of this, during any lesion of the particular end of long bone, leads to avascular necrosis of long bones, or short long bones. Now coming to venous drainage of long bones. These veins are usually valveless, and nutrient veins accompany the arteries. In the medullary cavity, a central venous sinus is present, which is served by radial collecting sinuses. In general, the venous layout is fan-shaped with cortical sinusoids, radiating outwards, towards the periosteal surface. Each Haversian canal is supplied by a solitary venous sinusoid. Dear students, one clinical question to you all, related to blood supply of long bone. The question is, in children, the metaphysis is a frequent location of osteomyelitis. Why? Osteomyelitis means inflammation, or infection of bone. Metaphysis is the area of very active growth of the long bone, and has rich blood supply. Before fusion of epiphysis with diaphysis, that is in children, the metaphyseal arteries are end arteries that form hairpin bends. The bacteria, or infected emboli, can be easily trapped in these hairpin bends of the metaphyseal arteries, causing osteomyelitis. At last, what are factors responsible for blood flow in long bones? These factors, also called as hemodynamic regulating mechanisms. They are as follows. Number 1, neural control. After sympathectomy, animals have more blood flow. So sympathetic innervation is essential for blood circulation. Number 2 is hormone control. There are alpha-1 adrenoceptors, muscarinic, and prostaglandin receptors, situated in the osseous system. Adrenaline may open arteriovenous shunts between nutritive arteries and sinusoids that drain into the central venous sinus, which increases transosseous venous return during exercise. Finally, number 3 is metabolic management. After ischemic healing, or healing after inadequate blood supply, the flow of blood goes up by 2 to 3 times. Dear students, at this point, I have finished the blood supply of long bone. I hope I have made myself clear to you all regarding this topic. If you missed the video that played before this one, it was about classification of bones. Link is given in the description box. Always maintain an optimistic outlook and hope for the best. I wish you the very best of luck. Thanks for watching. Please follow the channel, subscribe, comment and share your thoughts.